I believed and still believe that you can make your dreams work by brick, and you can accomplish anything with persistence. Assalamu alaikum dear viewers, welcome to yet another episode of Welkin Talkshow, and today we are here with the most important guest, Dr Asif Sadiq Wani. I am your host Arsh Latif, and today we will be asking and receiving some information regarding nephrology, the common habits of Kashmiri people which is damaging their health unknowingly, and what are the precautions that we can take. So Assalamu alaikum sir.
Assalamu alaikum Arsh.
Hope you're having a good day. Please introduce yourself to the viewers.
Hello viewers, I am Dr Asif Sadiq Wani. I did my MBBS from Government Medical College Jammu, then MD from Government Medical College Srinagar. Then I did my DNB for a brief period in Indraprasth Apollo Hospital, Delhi. Then I went for DM. I did it in between 2016 to 19 in SGPGI, Lucknow. And presently I am working as consultant nephrologist at Government Medical College, Srinagar.
Okay, so as a nephrologist, what are the most common cases you have to face every day?
As a nephrologist, we keep on seeing a spectrum of diseases which patients suffer related to kidneys. So most of them are like chronic kidney diseases, which are basically irreversible kind of kidney diseases. And the main principle of chronic kidney disease is that it's progressive, it's going to progress. As a nephrologist, what I do is that I try to diagnose what was the cause of the disease, what has caused this permanent kind of a damage in kidneys, and second, I try to retard the progression of the disease. And besides chronic kidney disease, then there are other diseases like what we call acute kidney injury, which is mostly reversible. Similarly, there are glomerular diseases. You might have seen maybe in your school also some young boys developing sort of facial puffiness or edema in their feet, and then diagnosed to have some protein in urine. So we see all shades of these kidney diseases and try to reach to some diagnosis and then treat them as per what is recommended. So to my understanding, kidney disease in present era is taking a toll. If you see the biggest disease which are killing people worldwide, chronic kidney disease or kidney disease in itself is ranked 10th as the 10th biggest cause of death worldwide. Wow. So it's of very significant concern to everybody, not only to doctors or to the patients, but also to policymakers, but also to those people who work for the welfare of community at large, who work for the welfare of society at large.
Yes, and we can see a lot of Kashmiri people are getting affected by this disease. So are there any common habits in Kashmiris which are resulting in all this?
What I understand, we too belong to an area of kidney stone disease. Basically, we have a belt of in India. We have a geographical region which we call stone belt, and we fall in that stone belt only. So you see, we, because of cold climate here, do not take proper care of our hydration. So the fluid intake generally is low as compared to other parts of the country or the world, and that's causing these stones to form. So if your urine is concentrated, which we generally look at the color of the urine, if it's little yellowish, and it causes supersaturation of the minerals in urine, and those minerals get precipitated and cause kidney stone formation, and kidney stones are not good for kidney health. Similarly, you can see that our lifestyle has changed. So previously we were more in farming, we were more active, we were more in sports.
Physical activity.
Physical activity was more. But now it has changed. The physical activity has drastically gone down. After the introduction of mobile phones and gaming and other things, now in young boys and school going children, they are not taking care of their outdoor sports. So they are not interested in outdoor sports. So that's taking a toll. You can see young boys obese. And obesity is also a risk factor for kidney disease. So if you find somebody with a weight which is more than what is expected as per his height, so that puts a lot of pressure on kidneys. So you have got two kidneys and they are expected to accept some weight of your body. So if your body weight goes drastically up, it takes a toll on your kidneys. Similarly, our food habits, we shifted from natural foods to junk foods.
Synthetic.
And most of these junk foods, processed foods, are high in salt, they're high in other compounds which can injure your kidneys. Then for every small little thing we gulp a pill, we take a tablet, sometimes over the counter, sometimes prescribed by doctors. So these all medications, whatever we take, they pass into urine, they pass through kidneys, and while going through the kidneys, they hit kidneys. So that's why the things are on the rise. Then diabetes in itself. Previously we would see diabetes was not this rampant, and then we had diabetic age, it was generally after 40-45 years of age. Now in present era I am seeing young boys as young as 25 years of age who are suffering from diabetes, and that's taking a toll, that's injuring our kidneys, that's being harmful to our kidney health.
Okay, so and we have a certain amount of creatinine level that we should have in our kidneys. So what is the what is the limit for that?
Basically every lab has its own cutoff beyond which we generally take that the creatinine is high. So there are some outliers, like if we take creatinine of 100 people, you will find some of them will be falling around the range of 0.6, 0.5, some would be going up to the range of 1.5. But most of the people generally have creatinine up to 1.2. So if your creatinine is more than upper limit of normal by any lab, you should reconfirm it. And if it is persistently high, and more importantly, if it's persistently rising, then you need to consult a doctor to see if there is a problem which is lying in your kidneys which is causing this rise in creatinine.
Okay, so and now we want to ask you a question about when you were studying for all this. Did you have a strategy which helped you reach here? How were you managing your study schedule and all? Basically,
right from the day since my childhood, I was very, very keen about studies. So this was something which would get me interested into. I was good in sports also, but later on I couldn't have the liberty to carry every hobby with me. But I was good in studies, and it kept me getting interested into it. What I realized as a student in my life, that I was never exam oriented. So that helped me. So I would always read for the sake of getting more information and then analyzing it through my brain. So every person in your class is going to read the same book and is going to be taught by the same teacher. So what makes a difference is how, as a student, different people will analyze that kind of information, and then through their analysis they will distill the information into their brain which they can use in future. So this is what I understand. The most important thing, I got very inspiring teachers throughout my life. So teachers have a great role to play. Rather than making students parrot what they want them to speak, it's more important they should let them think and give visualize and give wings to their ideas, give wings to their aspirations which they want to do. That's the most important thing.
Okay, so and we see mostly in winters Kashmiri consume a lot of what we say as some hoksun, and Kashmiris consume a lot of non-veg. So does that affect our health?
Of course, yes, because the best diet known to mankind is the Mediterranean diet, which is basically the diet which is being consumed in the Middle Eastern region around this. So that majorly is called healthy diet, and if you analyze that diet, you will find that it's rich in fresh fruits and vegetables. So consuming a thing which has been left sun-dried for some period of time, and then that sun is a powerful energy. It converts many of the innocent, or you can call simple molecules, into very complicated and harmful molecules. Then what we do, we add salt to these sun-dried vegetables, which is not good at all. We don't need any amount of salt. Like you might have seen many people saying, I have stopped taking the salt, now I am feeling weakness. That's not the case. It's all psychology. It's like if we don't take tea, we are not going to get any kind of physical weakness, but psychologically we are dependent on tea that we take regularly. So we feel that, oh, now that I have stopped the tea, I'm getting weakness. Similarly, salt, because whatever little salt we need in our body is being provided by the food we eat on daily basis. So you don't need extra table salt to add to your food or to mix in your vegetables. So my main understanding of this thing is that sun-dried vegetables, sun-dried fruits and other things are not good thing, and similarly pickles and which are rich in salt and other synthetic things should not be consumed very much. We should be having habits of taking more fresh fruits and vegetables and whole grains.
We are usually advised to take salt to maintain the iodine levels. So
that's because we live in a region which is iodine deficient. We are basically mountain people. So generally the content of iodine in salt in the soil is low because of the leaching. Rainfall takes it away deep, as compared to some coastal area or an area which is low lying, where the iodine content in the soil and then in the vegetables is good. So we need to take, that's just because iodine is added to salt does not mean we need to take more salt. It's like we are taking salt and everything, that's why they have iodized it. There are many things. If you go to some other places like US and UK, you will find other things are fortified with iodine and vitamins and minerals, which are not basically salt based. Yeah.
Okay, so at last, what do you want to, what is the message you want to convey to the people who aspire to become a doctor?
My message to the people who really want to become a doctor is that if you really want to become a doctor, then only you should become a doctor. Reason is it's kind of taxing job. And then you need to deal with the people who are not happy with whatever is happening with their lives. So you can meet a young boy who is just in his teens and 20s and is not able to play just because of his health condition, or you may meet a 40-year-old middle-aged guy who is on the peak of his career but is seeing losing everything because of a disease. So you have to deal with these kind of people, and they most of the times are not happy people. So you cannot expect a diseased person or a sick person or an ill person to be happy, of course not. So when you deal with such kind of people, so there is a lot of stress in your mind. Then every person is different. A tablet which is going to work for someone is not going to work for the other person. Every person is different, and every patient for us is a new textbook with his own demands, with his own requirements. And so what the result will be from your most methodological or scientific treatment is not necessarily does not necessarily sometimes translate into good outcome. So that gives you a lot of stress, and then you have to keep yourself updated every day, every night. There is research which is on it, ongoing in medical sciences, and you have to keep yourself abreast with newer happenings. So it's really a tough job, but then at the end of the day you are happy because you have helped people, you have touched so many lives, and you make a difference in their lives by using your knowledge and by putting in extra effort to make them to decrease their pain and suffering.
So dear viewers, that was all for today, and remember, if you really want to become a doctor, then become a doctor. So it was really a pleasure to have you today, and that's all for today.
Thank you.
Thank you.
Thank you.